Hi, my name is Joy Lehman. I'm a pharmacist at The Ohio State University Wexner Medical Center. I currently practice in the areas of non-oncology infusion, and I help with medication management and compliance across all of our ambulatory sites, as well as our OSU physician practice. I have been at the medical center for almost 20 years now, and I completed both my BS in pharmacy and my Doctor of Pharmacy at Ohio State in the late 1990s, as well as my specialty practice residency at Ohio State. So lots of history with Ohio State. I had a short period of time after my residency where I worked in home infusion and then returned to the medical center as a clinical specialist and worked in neonatal intensive care unit as well as high-risk maternal fetal medicine. I had a big career change about 5 years ago, and that evolved into my current role. And so I've been in ambulatory pharmacy for the last 5 years, and I've really enjoyed it. As far as professional goals, I'm really excited because we are at a time period of tremendous growth at the university in ambulatory care. They are just starting to build our first large office practice outside of the 270 corridor, and there's a total of 3 additional planned right now, and possibly a fourth one to really reach patients across the central Ohio region. And all of those sites are going to have ambulatory practices in various disease states as well as infusion. So I'm really anticipating growth in my staff. And as I said, it's just really exciting time for me as a manager and exciting time for my staff to know that our services are valued and the university is investing in them. As far as what does community-based pharmacy mean to me, I know we'll be hearing from Mary Alice Bennett this week. She's a longtime friend and mentor to me, and she has always defined community as anything outside of the hospital. And I really feel like you could even take that a step further, and I really think of community pharmacy as across the continuum or across time. Because in the hospital, when I would see patients, it was very acutely, very intense, and we were really focused on just a few things. And in community-based pharmacy, you're seeing patients much more holistically, and you're seeing them for a long period of time. In infusion especially, we treat chronic disease states. We see things such as multiple sclerosis and rheumatoid arthritis and IBD. And unfortunately, we don't have curative therapies. We've made tremendous strides in the management of those diseases, but patients have to return. And so we use that opportunity to really meet those patients and understand their disease states, how they're improving, as well as hopefully also touch on any other disease states that they may be having. So we really have unique opportunities in infusion. I'm really excited for this course because I've really appreciated the work that I have done collaboratively, with other pharmacists across the medical center, as well as our colleagues in the combined residency with Kroger. I hadn't had much experience with the retail setting and the tremendous work that they're doing, both clinically and operationally, and I've really enjoyed their insight and input throughout the various classes that we've had. And all of our patients use community pharmacy, and so having that knowledge is really invaluable as I go back to my practice sites. As far as opportunities and challenges, I think the biggest opportunity right now is for us to maintain the pace of growth. As I said, Ohio State alone is expanding community pharmacy or ambulatory pharmacy at a very rapid rate. There are many more inpatient residency programs than there are community-based programs. I know Ohio State has a really highly regarded, what I feel one of the best in the country, community-based pharmacy practices or residency sites. But I think more sites, particularly academic medical institutions and colleges of pharmacy, need to invest in these residencies in order for us to meet the patients where they are. I think as far as challenges, I think the biggest challenge right now is reimbursement. And pharmacists really don't get paid equitably when you look at the services they can provide in comparison to other providers. And pharmacists are really providing in-depth care, and it has been shown time and time again that we save both the patient and the payer as well as the health system money. And so we should be getting reimbursed appropriately. The state of Ohio has made huge advances of this based on advocacy work done at this university and with the Ohio Pharmacists Association as well as APHA, but there is a lot more to do. And so I look forward to hopefully one day seeing increases in the reimbursement that pharmacists are getting for the services that they provide, and that more pharmacist services are getting reimbursed outside of just the traditional clinic visit. So it's an exciting time. I'm really looking forward to this course and meeting everyone throughout the semester. Thank you very much.